Namaste everybody. I am Dr. Suhas Kumar Shetty, Principal and Medical Director at KLE Sri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgavi, and basically a specialization in Manas Roga, that is Ayurvedic psychiatry, and have been practicing different aspects of prevention as well as the management of various common psychiatric disorders like depression, anxiety, substance abuse, epilepsy, etc. And I'm very happy to be a part of this particular event. I'm very happy to share today with you the topic telemedicine, variables, and Ayurveda. As you all know that we are moving in a fast era of technology, and technology inevitably becomes very, very important for any healthcare system. Though we claim Ayurveda to be one of the most comprehensive ancient system of medicine, but of course, there is no denying that technology can also be a part of Ayurvedic education, Ayurvedic research, and Ayurvedic healthcare system. So that is where probably I will try to give few of my insights, inputs, and also share my experiences, what we have in our institution, how we are trying to integrate different technology, the use of telemedicines, what are the researches that we have been doing on variables, and how it could create an impact in Ayurveda. So this is what will be my overall content of today's presentation. I'll probably give you a brief overview of what exactly is the information technology, what is machine learning, what is the importance of artificial intelligence, and how all of these concepts, all of these services can be used in the better diagnosis, better management, follow-up of Ayurvedic treatment and the treatment protocols, and especially benefiting the patients. Because whenever we are talking about any system or any services, it is very, very important that it takes care about the need of the people, need of the society, need of the community. And that is where we could be more acceptable, affordable, accessible if we are able to make it patient-centric. And that is the very important experience that we have, that whatever we come across, it is very important that we increase the visibility of that. And whatever the technology we are using should be valid, should be reliable, should be standardized, and very, very important, should be practical. So I feel these are the four important aspects of any tools or any services or any technology or any important services that we are trying to introduce, that it should be able to have this basic four qualities, that it should be valid, it should be reliable, it should be standardized, and it should be practical for the common people. So validity refers to that it is able to capture what it is supposed to capture. We are able to get what we are supposed to get. Suppose it is going to capture the variations of the biological phenomena of doshas. At the end of your assessment, it should be able to give you the data in terms of the variation of the doshas. When you say should be reliable, it is about the reproducibility. If it is used by different settings, by different set of people, it should be able to give the same results and same outcome. And then it should be standardized. There should be a clear defined protocols. There should be a clearly defined standard operating procedures, so that whatever we are trying to use it should be able to be applicable at large. And lastly, it should be able to be practically applicable. That it should be useful in terms of diagnosis, in terms of management, in terms of prevention. And that is where I strongly believe that Ayurveda can contribute not only in the management, but significant enough in terms of the preventions. Because we know that the people of the young age or the childhood are dominant with kapha dosha. Then in the middle age, pitta dosha. In the old age, vata dosha. So if we can have a sense of a measurable quantification of what other amount of the vitiation that we are having and how we could be able to help them, then definitely we can prevent many of the diseases that people are suffering with. So little bit of focus on their diet, what is the type of diet, how much of the doshik vitiation is there, how far they are sattvic, how far they are in terms of calories, nutrition, and how far they are in terms of whether they are the sattviya to an individual, or how whether we are using anything that is said to be viruddha. All this probably, if we are able to consider, we can use a lot of things. So there are a lot of technology which we can definitely bring to the different aspects. So before that, probably I'll just try to give you some common terms that we use in this telemedicines or variables, or very in briefly about the information technology we have. So there are three basic words that we come across: the IT, which is called as information technology; we have ML, which stands for machine learning; and AI, which stands for artificial intelligence. So basically, the information technology is where we are using the latest techniques, technologies in terms of improving our healthcare system. So usage of the technology in terms of getting a better information, in terms of getting a better knowledge, in terms of getting data. And what happens in this information technology is that we're going to capture huge amount of data. And that is where probably we have to come across something called as big data analysis. So there are four ways how we analyze a data. So how exactly we're using the data. Because again, being specialized in medical statistics and being a faculty for more than 2 decades, I always would like to play with these numbers and use these numbers for analysis. So there are four basic ways how you can use any data with you. The first would be to use them for the description. So they call as descriptive data, where you're trying to tell in terms of like this is in terms of percentage, or in terms of the percentile, etc., in terms of standard deviation, mean, etc. Then gradually we try to explore further. This exploratory aspects, we try to link in terms of association, in terms of some correlation, etc. Then comes the analysis. We are trying to analyze the things. And then fourthly, we come with the prescriptive method of data analysis. So we have the descriptive approach, then the exploratory approach, analytical approach, and then we have the prescriptive approach. And this is very, very important in case of information technology. Next comes the machine learning, which is called as where the machine or the computer learns from a training set of data where the outcomes are mapped to a specific data characteristics. And then we have this, how we are able to come out with this. Whereas the artificial intelligence is more autonomous, it also automatically captures the things and gives the output. Whereas machine learning just captures and then connects with a specific data characters. And that's the basic difference between the machine learning and the artificial intelligence. The outcome is automatically given in case of artificial intelligence. We have to give the specific characters for case of the machine learning. So ideally, if you're using technology, maybe you're talking in terms of variables, or you're talking in terms of the telemedicine or telehealth, and etc. Wherever you want to use technology, and specifically you want to use for healthcare system, including Ayurveda, what are the important characteristic features that you should look for in technology? The first and foremost thing is that this tech system or technology system should be patient-centric, because it should be useful for the patients to monitor, to diagnose, to prevent, to screen, and to also do the follow-up in terms of his healthcare issues. Next is, it should be thoughtfully applied, because it should be very comprehensive, very holistic. It should cover all the aspects of a particular information that you're trying to capture. Then technology should have invisible interface whenever possible. No, everything may not be just available, but also invisibly trying to capture the informations. Then it should be carefully integrated. See what happens many times, there are a lot of information which are available in remote areas. Now how we can integrate all this and how we can make it very, very comprehensively available at one single place. Then it should be working as a team, and there should be a small, sometimes less is best. So it should not be, there should not be very complex data that is there and it is difficult for interpretation. See, interpretation refers to we're giving meaning to the data. The outcome that you're getting, trying to give the meaning to that information, and that is very, very important. And then, see, of course, we always would accept this, that this technology cannot replace the human, but of course, it can aid, or it can access, or it can make the information available. And it has its own merits and demerits, it has its own strength, and it has its own barriers or challenges, which probably we'll try to talk in terms. See, now coming to how we can use this telemedicines, and how important is this telemedicines. In fact, I think we all should thank COVID for teaching us many things, like online sessions, online interviews, how we are able to interact with people through various social media. We are all how teaching, learning took the new platforms, how people were able to teach, learn through the online platforms. So there were a lot of new things that we were able to learn through this during this COVID pandemic. Again, one of the very important area which also developed during this pandemic, though it existed, undoubtedly it existed, but really it took an upsurge during the COVID pandemic. The people started using it for various types of healthcare services, because the orthodox or the conventional type of healthcare system was not available for the people, and people had to depend on some alternatives, which was provided through health telemedicines. In fact, we also in our institution started this during the COVID pandemic, in the first cycle of the COVID pandemic, where they're able to available, like we made a team, like a day-wise team. We made a set of 4 hours people, where they were able to talk to the people, make them assessment, help them in terms of the diet, lifestyle advices, give them some basic home remedies, and if needed, we're also prescribing some prescriptions also, where we were able to send the medicines. This was very, very useful. And being from background from mental health, I think we really played a great roles. We're also a part of the triage, which was being initiated by the government of Karnataka, where we and our team were the first contact people with the people who were diagnosed with COVID positives, and we used to give them the different guidelines of whether they should stay at home, or whether they should take the medicines at the nearby PHCs, or they should get admitted in a COVID center. So this was our opportunity that we could get through this particular triage initiated by the government of Karnataka, and this was only possible through this telemedicines. There has been a great thing in terms of its usage, and its usage. In fact, we should really appreciate the efforts of Dr. Pratap Chauhan and Jiva Ayurveda, where they initially started this introducing the concept of telemedicines in Ayurveda way back in 1995, and since then they really have been expanding and scaling up and reaching more than 8,000 to 10,000 people every day. And not only this, it has been in other areas also, where they have been able to develop various newer initiatives in terms of the telemedicines. Like we have the telemedicines project by Narayana Hrudayalaya, which is a cardiac care center, super specialty cardiac care center in Bangalore. We also have the projects like a National Cancer Network called as OncoNet, which mainly takes care about the cancer patients. In fact, we also have a specialty care center, an integrative Ayurvedic cancer center called as Abhaya, where we also use the telemedicines to reach the people, especially for their follow-ups, those who are remotely present, those who are underprivileged in terms of the medical facilities. We are trying to use the telemedicine services to them. We also have the Integrated Disease Surveillance Project, the National Rural Telemedicine Network, and the National Medical College Network, Digital Medical Library Network. So these are some of the initiatives by various government and private organizations where they are trying to bring the um, healthcare at the doorsteps. And with a country which is so much of diversity like India, it's so much of remote, people have to travel the 20, 30 kilometers, sometimes 50 kilometers to get some medical facilities. I think this can be a real boon for them to be a part of this particular telemedicine services. So if you look at how these telemedicines could be used in Ayurveda and what are the important areas where we can use. See, of course, undoubtedly it can be used in the management, but it can also be used for the wellness, or it can also be used for preventive healthcare. If people can identify the early symptoms of any healthcare conditions, the primary screening can be done in terms of children, maybe adolescent, old age problem. Like for example, if you want to screen the patients of Alzheimer's dementia or Parkinson's disease, any motor or movement disorders. So we always can use this telemedicines and probably try to screen them, and this can be very, very helpful. So basically, if we can broadly classify into four categories, like the health management, the throughout care of the patients, then the prescription compliance, and store and forward. So these are the four areas or four features of a good healthcare system or telemedicine's usage in the medical healthcare system, especially in terms of the chronic health management, like especially the care after they take the preliminary care in the hospital, the follow-ups, and whether they are getting compliance with the medications, whether they are following the treatment protocols, whether they have any difficulties or challenges, can also be taken care. The super specialty care, sometimes especially for the screening for the patients, the super specialty care can be done with the help of telemedicines. And then we have a team-based medicines which can be used, where we have a integrative approach from different systems or different care can be given. Then the follow-ups literally throughout the care, the follow-ups care can be given with the help of telemedicines. We also, because it is more very flexible way of taking care of the individuals, then especially the chronic diseases which need to a long-term care like osteoarthritis or diabetes or complications of hypertension, cancer, any neurological disorders, stroke management, they all definitely would need a very long-term follow. So that is where probably, and every time patient may not be able to come for the hospital. And that is where probably the telemedicines can play a very, very important role. And then we have the prescription compliance. Like especially suppose you want to take a second opinion about a conditions. You want to talk to some doctors or take an add-on suggestions for the prescriptions. We can always do that. Of course, in mental health care, this can be of great help because people do not would like to approach or to have a face-to-face interaction. They would always seek for some solutions. So sometimes, and that is where probably like something like the Chat GPT is of great help in managing the psychiatric patients or in case of screening the psychiatric patients. And of course, by this telemedicines, we can always take the help of the dietary advices, lifestyle conditions, etc. And they can also look towards the store and the forward in terms of the what are the other alternatives that we have. What are other therapies like yoga, meditation, pranayama, reiki, pranic healing. All this can always be advised, or you want to take them in some basic relaxation techniques can always be taken care for them. And then probably if there's some natural disasters or big calamities, so we can always use them people at mask. And also, especially the elderly care can always be given with the help of the telemedicines. So if you want to apply the telemedicines, it has a very broader area, and what probably we are trying to look at or we are trying to apply, like in terms of the telehealth, like creating awareness about the health, maybe making them approachable, making them know that to understand their status of health, what exactly is their health status. So that is why like swasthya monitoring assessment is what we have been initiating, trying to assess the health status of the individuals and how much of deviation is there from the health, so that we can always advise them whether they need a non-pharmacological approach or whether they need some form of medications, they want some therapies, some panchakarma, some treatments, they always can be guided about. Then, especially for people who are disabled, I think telemedicine can be a great help because very often they will not be able to be mobilized. So, remote services available through the experts can always be a great services. Then, especially the school-going children or their office-going people, again, they may find difficult to visit the hospital and spend time on a regular basis. So, that is where probably again this telemedicine can be applicable. Or in those conditions where probably you may not require laboratory examinations or some radiological examinations are not needed. In such conditions, again, telemedicine can be of greater help. It can also enhance the overall healthcare system performance also. Then also it can improve the health coordinations or the treatment coordinations. Then it can also minimize the traveling of the patient. So for those who are remotely available, they can do that. Then better services for the clinicians and as well as the patient. The digital health monitoring, and suppose you want to use them for skin care or any of the things where it can be easily be done through the telemedicine. Again, you know, travel. Or you want to track the patient for medication. This is very, very important, especially if the patient is on chronic diseases and you want to be monitoring him for medications. You can always see take the help of the telemedicine, and it is very, very cost effective. See, ideally you need a treatment which is effective, which is easily available, accessible, affordable. So this is the very important prerequisite for a good or successful treatment protocols. So, but at the same time, there are some barriers or limitations of this telemedicine also. That's what we have been able to face in the last few years. That sometimes the problem is with the confidentiality of the information that we are sharing. Sometimes it could be very complex. Just by having a conversation through online may not be sufficient or may not be cases. Sometimes there could be cases of misdiagnosis. We may not be able to diagnose the patient comprehensively. Then we have the controlled substances. There could also be medical liabilities, data accuracy, data privacy, etc. So these are some of the important challenges or barriers related with the shortcuts. So let me just give you what exactly how we are using technology, how we are using this telemedicine and variables in our institutions. In our institution, we work with the three basic principles of tradition, technology, and innovation. We want to use the principles of the tradition with combining with or blending with the technology for the newer innovations. So these are the three basic principles on which our institution we are working about. And we have developed a department of Ayurveda technology, and we all have an exclusive incubation center. Maybe the first of its kind, where it was established in 2014, where we are able to use the technology, use all these techniques, and we are try to use multidisciplinary approach, taking the help of technology people, engineers, biotech people, scientists, and trying to develop newer maybe techniques, technology, instruments, newer formulations, apps for the better services of Ayurveda. So for which we are able to develop various types of instruments also, like for Vamana, Basti, Nasya, Parisheka, Kati Basti, Janu Basti. We have been able to design and develop different types of instruments, and we are trying to use and for which we have been using different technologies aspect. We also are trying to train the students and staff in these areas of technology, and there have been many patents which have also been granted. We have filed more than 5 patents. 3 has been granted, who have been published, and we are in the process of applying for few more patents in the areas of how we are trying to interface technology with Ayurveda. We have been collaborating with various organizations like ICMR, Ayush, DBT, CSIR, IGIB, and various other industries to develop various technologies. A few of the things where we are trying to work is also like robotics, like fumigation robotics, using artificial intelligence and machine learning for diagnosis of tongue, like whether we are able to diagnose the dosha based on tongue, diagnose the different types of skin disorders based on the parameters. The skin, the twacha, twacha is also being developed. We are trying to having collaborations with various institutions, with engineering college, with technology institutions also, and that is why probably we are getting a very good help in not only in the technology driven, but also using them in getting the best of the technology, and that is what they also have been helping us in making the best of the practices of telemedicine. We are also trying to develop various aspects of variables also. Basically, variables can be of two types, which is primary variables and the secondary variables. So primary variables, it talks about all the general aspects of the maybe in terms of the diet, in terms of workouts, in terms of heart rate, blood pressure, etc. Whereas the secondary is very specific, like you want to know about the heart variabilities, you want to know about only the pulse, you want to know about the calories, you want to know about how much of walking we have done, how much of workout we have done. There are specific things. And even if we can try to integrate, what is very, very important is trying to integrate the principles of Ayurveda to this technology. That is very, very important. We should not lose the whole concrete of or the concept of Ayurveda when we are trying to develop this. See, even there are very new initiatives, like one of the initiatives is e-Manas, which has been developed by the government of Karnataka for mental health care, where people can approach for the different service providers. In fact, our institution was the first Ayurvedic institution to be registered under the mental health establishment, and where we were a part of this particular team called as e-Manas. Through this particular telemedicines, we are able to reach to the people, and those people who would like to have the Ayurvedic approach for mental health are being directed to us, and then we have a team for that who tries to address them at the basic levels. And if we feel that the patient needs hospitalizations or need to be contacted to the patients, then they come up as a follow-up to us or hospital, and we are trying to give a good care and maintain all the possible records for the same. So the variable technology becomes a very viable means to provide a low-cost, clinically sensitive data for more informed patient assessment. See, the basic benefit of variable technology seems obvious because they are very small, owned discreetly in any environment, personalized data are available, and it is trying to integration into the communication network, which facilitates the remote monitoring. You need not monitor the patients, it's always there with the patients, so that we can always come up with that. So here also we are trying to develop the assessment of the dosha, the Agni status, and basic works. We are trying to work on that, and we have been always been trying to see how best we are able to provide use the technology for the betterment of the patients. So it also provides an overview of the common challenges facing the variable technology if it is to transition from the novel gadgets to an efficient, valid and reliable clinical tool to be used by wide range of Ayurveda Vaidyas. So to conclude, I would like to say that definitely we cannot be behind technology. Technology will always be the future, and but at the same time we need to understand the whole core concepts and how we are trying to integrate the basic concepts of Ayurveda with the means of technology, and it can be the interdisciplinary or the multidisciplinary approach, the multidisciplinary team which can be used for developing that. But understanding the strength and limitations of the technologies are very, very equally important. We definitely would like to agree that the technology can always assist the humans, but definitely may not replace the human touch, which is very, very important in the patient care. And that too, when we're talking about the mental health care, the personal touch becomes very, very important. So probably, I would like to conclude saying that in this era of artificial intelligence, the Ayurveda intelligence is very, very important. So it has been, I had an opportunity to also meet Krishna Kumar ji when I was working in Hassan, where he had come as for Guru Vandana during Shishyopanayana, and had a great privilege of spending 2 days with him. The type of vision that he has and the type of the commitment that he has towards the science, and how without compromising the basic science, how we could integrate and combine the technologies. I was really mesmerized by his vision, by his great dream. We all definitely should join hands together and see that we can make his dream come true, where we are trying to integrate the basic concepts of Ayurveda with the best of technology. So these are few of my inputs. I would like to thank the entire organizers for these wonderful opportunities, and if there are any more to share and interact, I'll be very, very happy to do that. So once again, thank you very much.